Ovarian cancer's greatest danger lies in its silence. While many cancers announce their presence with obvious symptoms or clear screening tests, ovarian cancer quietly develops, often unnoticed, until it's progressed to a more advanced, less treatable stage. Most women, and even their doctors, may mistake its vague symptoms for far less serious health concerns. But here's where it gets complicated. Ovarian cancer is notorious for presenting in ways that baffle both patients and physicians. Dr. Jamie Bakkum-Gamez, a gynecologic oncologist at the Mayo Clinic in Rochester, Minnesota, thinks about ovarian cancer every day, not just as a physician, but as a woman aware of her own risk. She points out how quickly ovarian cancer can transform, growing from tiny and invisible to widespread within just a few months. This unpredictability makes her scrutiny of her own health all the more intense. Every day I see firsthand the toll ovarian cancer takes on patients, she says. It's something I always keep in mind, especially knowing my own risk factors. At 49 years old, Dr. Bakkum-Gamez acknowledges a personal risk. She's never been pregnant. Age itself is another risk factor, as cancer risk increases with the passing years. She keeps close tabs on her own health, especially given that around 20% of ovarian cancers are linked to genetic mutations passed down through families, such as BRCA1 and BRCA2. No one in her family has had ovarian or breast cancer so far, but she emphasizes she would have pursued genetic testing if they had. To protect herself, she focuses on healthy lifestyle fundamentals: regular exercise, a balanced diet, yearly pelvic exams, and staying up to date with other recommended cancer screenings. So which symptoms make Dr. Bakkum-Gamez stop and take notice in her own body? Here are the 4 key indicators she monitors carefully. 1. Bloating. That uncomfortable feeling of bloating, tight pants, a noticeably swollen abdomen, ranks as the most common early red flag Dr. Bakkum-Gamez spots in her patients. She's attuned to it herself, meticulously differentiating between bloating caused by ordinary weight gain and the kind that feels unfamiliar or persistent. Many women assume gained weight is just a result of eating differently or exercising less, but in reality, ovarian cancer can cause a buildup of fluid, ascites within the abdomen, leading to a visibly distended belly. She checks to see if she can grasp additional fat on her abdomen, suggesting weight gain from lifestyle factors, or if her belly feels unusually hard or the bloating won't subside with a trip to the bathroom. Women often face further confusion during menopause, as normal hormonal changes can also lead to abdominal weight gain, blurring the lines even more between benign body changes and something more serious. It's genuinely frustrating, she admits. 2. Feeling full too quickly, early satiety. Have you noticed you get full after just a small meal? Dr. Bakkum-Gamez is always alert for this, a symptom known as early satiety. When tumors or fluid occupy space in the abdomen, the stomach can't expand as much, so a little food can make you feel full fast. She encourages anyone experiencing this, to the point it seems unusual, to seek a thorough medical evaluation. 3. Frequent urination. If you're suddenly waking up several times at night to use the bathroom, or finding you need to urinate more often in general, it could be something to watch. When there's a tumor or large mass crowding the pelvis, it can mean the bladder never fills completely, triggering more frequent urges to go. Dr. Bakkum-Gamez regularly asks her patients how many times they need to urinate that night, knowing that a sudden increase from 0 or 1 trip to 3 or 4 could signal a problem. 4. Changes in bowel habits. Keep an eye out for constipation or diarrhea that doesn't resolve on its own. Ovarian cancer tends to spread along the surface of the abdominal lining, which covers the intestines as well. Even small tumors can affect how the bowels work, sometimes pressing on critical sections of the large intestine and causing constipation. But here's the tricky part. Such digestive changes are also common with many other conditions, making it easy to overlook the possibility of cancer. Now, let's explore what increases your risk. The American Cancer Society highlights older age, with most ovarian cancer patients diagnosed in their 60s. Inherited gene mutations, BRCA1, BRCA2, or Lynch syndrome, which can dramatically raise risk. starting periods before age 12, or entering menopause after age 52, never having been pregnant. For women carrying risky gene mutations, Dr. Bakkum-Gamez notes that preventive surgery to remove the ovaries and fallopian tubes is sometimes advised. In fact, current guidelines recommend that even women having their tubes tied consider removing the fallopian tubes to further decrease cancer risk, a suggestion some may find controversial. Is this recommendation too aggressive, or an essential step in prevention? Let us know what you think. Diagnosing ovarian cancer remains challenging. Other warning signs include vaginal bleeding after menopause, ongoing pelvic pain, or persistent back and abdominal discomfort. If any symptoms last more than a week or two, Dr. Bakkum-Gamez encourages immediate medical attention. Doctors may detect masses during pelvic or abdominal exams, and ultrasounds provide the most detailed imaging currently available. However, even ultrasounds can miss early-stage cancers. They're just too small to be seen. A blood test called CA-125 may help track tumor markers, but it's far from perfect. CA-125 can rise for reasons unrelated to cancer, making it unreliable as a population-level screening tool. The harsh reality, says Dr. Bakkum-Gamez, is that we still lack an effective routine screening test for ovarian cancer. Countless researchers across the globe have worked tirelessly, but we're not there yet. And this is the part most people miss. Despite advances in cancer detection, ovarian cancer continues to elude early diagnosis. Should more resources be invested into developing a screening test? Or is a focus on public awareness and symptom recognition the true game changer? We want to hear your thoughts. Do you agree with Dr. Bakkum-Gamez's approach? Or do you think there's something more we should be doing? Join the discussion and share your perspective below.